Hi everyone, Bill Lethman here for MoneyEvolution.com. In today's video, I'm going to be talking about how to choose a healthcare plan. So we're currently in the middle of open enrollment season and we're in the process of choosing a new healthcare plan for our family. Fortunately, we get our healthcare insurance through my wife's employer, which really, as a small business owner, saves us a lot of money. So what I want to do here in this video is I want to go through the three options that we have. We're going to talk about some terms and definitions, and as you're watching this video, think about the options that we have and maybe compare that to some of the options that you have, and maybe it'll bring up some questions that you should be thinking about or asking before you enroll in your healthcare plan. So as we see, we got lots of numbers on here, so we're going to try to explain this the best as possible. But the first thing we want to do is talk a little bit about some basic terms and definitions. So the first term we want to talk about is the premium, and that's of course the amount of money that you pay for the health insurance. That's deducted right out of the paycheck, usually once a month or every pay period. And we're going to start all the way over here on the far right, and we have a program option called the network option. This is a very closed network of doctors and providers, and for that program it's $249 per pay period. My wife gets paid every 2 weeks. We have 26 of those pay periods for a total of $6,474 for the year that we're going to pay there. The middle option here is the extended network, and so that includes that same basic network of doctors, but it also includes a little bit more extended network, but it also allows as well for us to go out of that network. If we happen to be traveling out of state, we can go to really any doctor and eventually we'll have some coverage there. That's going to be the most expensive of these three options. That's $453 per pay period for a total of $11,778. Then all the way over here on the left, we have the savings option. This is something that allows you to also do an HSA savings, which we're going to talk about a little bit towards the end. But that's the cheapest option. It's only $112 per pay period for a total of $2,912. And so, of course, the premium is not the only factor when choosing one of these plans. If it was, we would just go right over here to the savings. But as you're exploring this, you want to look and think about what are some of the healthcare needs of you and your family. And one thing we want to look at right off the bat is the deductible. And let's start, in fact, over here on the far right. So the basic network has a very simple deductible of $1,000. And what that means is that the first $1,000 of medical expenses, you're going to pay that 100%. And the insurance company is only going to start kicking in money after that deductible is met. And then you have a copay. That's another one of these terms and definitions. So a copay means you're going to pay a fixed dollar amount depending on the service that they're providing there. And that could range anywhere from $20 to $40. That's for a doctor's visit, for example. An emergency room, that's going to be a lot more expensive. That's actually going to be a $135 copay for that. But that's going to be topped out. You know exactly how much you're paying there. Let's go over here to the middle one, because that gets a little bit more complicated. Remember, we actually have three different networks here. So if you're in that same basic network that has a deductible of $1,000, just like the network one, but it also has two other deductibles, one for $3,000, that's going to be for the expanded network, and another one for $6,000, that's going to be the deductible that's going to be met if you're paying healthcare expenses out of the network. So if you happen to be traveling out of state, or you want to go to a doctor or a hospital that is not part of that core network, you've got that capped out. And then there's a copay once that deductible is met, and that's going to range anywhere from $40 to $55 after the deductible is met. Over here on the savings plan option, the three deductibles are $3,500 compared to $1,000 for the in-network, $7,000 compared to $3,000 for the expanded network, and $10,000 deductible compared to the $6,000 deductible for the out-of-network providers there. Another term we want to look at here, though, is coinsurance. Now, that's different from a copay, because a coinsurance means that you're going to pick up a percentage of the cost, or the insurance company is going to pick up a percentage of that. And basically, depending on what service and where you're at, it could be between 15 and 40% that you're going to have to pay of whatever that bill is. So $1,000 bill, and if you're at 15%, you're going to have to pay $150 of that. Fortunately, for all of these plans, another term that we want to pay attention to is the max out of pocket. So that's the maximum amount that you could be on the hook for over and beyond the premium. So I'll start over here with the network on the far right. The max out of pocket for that is $6,000 for the year. So in addition to paying that premium, no matter what happens here with the deductibles and the copays, the most you can expect to pay for this is another $6,000 over and above that. So about $12,474 for the year. In the expanded network, again, there's going to be a maximum out-of-pocket for each of the 3 levels there. So if you're staying in network, it's the same deductible as the network, $6,000 a year. But if it's in the expanded network, it goes up to $10,000 maximum out-of-pocket. And if you're out of the network, you could pay up to $20,000. So very important things to think about there. And then if we go all the way over here to the savings option, the max out-of-pocket's a little bit steeper in that case, $11,100 for the network, $13,300 for the expanded network, and $24,000 for the out-of-network here. So what are a couple things to think about? Well, one is, what is my need for health care insurance? If you think you're reasonably healthy, our family, fortunately, is pretty healthy, although we've had a couple little bumps in the road. My daughter had a knee surgery here about 1.5 years ago, and so there's things that do crop up, but generally speaking, we're pretty healthy. So we generally opt for this savings plan because it's going to be the lowest cost, but it also allows us to do something called an HSA plan. And if you've watched some of my other videos, you probably know how much I like HSAs. And so what we do is to kind of compensate or to kind of prep ourselves for some of these unexpected costs is we contribute the maximum amount to an HSA. And for a family for 2019, that's $7,000 a year. So we could put $7,000 into the HSA, and that goes a long way towards paying some of these out-of-pocket expenses. HSAs come right out of the paycheck. There's no tax that's, you're not paying any taxes on that. And as long as it's used for a qualified medical expense, you don't pay any taxes on the withdrawals either. And if you don't use the HSA, that carries over whatever balance is unused for the next year. So the idea is that even if you do have a couple bumps in the road along the way, hopefully you're not using that up every single year, and a little bit carries over, and eventually you build up a little bit of a balance. And that's one of the things we're trying to do, being in my late 40s here now, I guess, getting ready for retirement. Hopefully we'll be able to build up a little bit bigger balance in this HSA to cover some of those retirement healthcare costs, which I've got a couple other videos about that. We didn't give a lot of consideration over here to the network plan, primarily for the reason that it is so restrictive on the doctors that are provided in that. We like to travel, so if you happen to be traveling out of state or out of the country for that matter, you may just be kind of really out of luck and really having to pick up all those expenses on your own. And in the extended network, that might be a great program for somebody that if you know that you have things that are coming up, or if you see doctors on a regular basis, it might be something advantageous for you to know a little bit more precisely how much some of your healthcare expenses are going to be, because here they're a little bit more controlled versus what we have over here in the savings plan. So with that, I hope this has been helpful for you. Open enrollment is going on right now. You might be watching this video at a different time, so if you are, save this video and watch it the next time you have open enrollment for your healthcare benefits. Unfortunately, healthcare costs and insurance in general is one of what I call the 4 big expenses, and healthcare is certainly usually the biggest of those. So managing those expenses, I think, is certainly something that is going to help your overall financial situation. So if you like what we're doing here, remember to hit that like or subscribe button. If you'd like, check out our free resources section over on our blog at moneyevolution.com, and I'll see you back in one of my next videos. Thanks.